My ladies, if your vagina has been itching you like you have an unfinished business, wait first. Not every infection is toilet infection. Let's talk about the real meaning of vaginal yeast infection and how to know if you have it. Vaginal yeast infection happens when a fungus called Candida grows too much in the vagina. The vagina naturally has a yeast plus a bacteria, but when the balance is disturbed, the yeast now outgrows and causes infection. It is not a sexually transmitted infection, though sex can sometimes trigger the symptoms. Now let's talk about the common signs and symptoms that shows you have this yeast infection. One is intense vaginal itching, the types that makes you uncomfortable in public. Two is thick white discharge like cottage cheese. You normally see it in your vagina, coming out from your vagina. Three is redness and swelling around your vulva. Four, burning sensation, especially during urination. Five, pain during sex. For some people though. Then six, no strong smell. Yeast infection usually don't have a bad odor. So what are the causes of this yeast infection? Anything that disrupts the vaginal balance can cause this yeast infection, like one, overusing antibiotics. If your healthcare provider has not prescribed antibiotics for you, please do not buy them yourself and abuse it. It can be more harmful than you think. They kill good bacteria that controls yeast. Two is pregnancy. Yeast infections are common during pregnancy because hormones changes can upset the pH balance of a vagina. Three is high blood sugar or diabetes mellitus. High blood sugar from diabetes mellitus significantly increases your risk of vaginal yeast infection because excess sugar creates a perfect environment for the candida fungus to overgrow. When the blood sugar is high, sugar can appear in the sweat, in the mucus, and urine, feeding the yeast and then weakening your immune system's ability to fight it off, leading to a more frequent and recurrent infection. Three is weak immune system. A weak immune system significantly increases your risk for vaginal yeast infection as your body's defense can't control the normal candida yeast overgrowth, leading to infection, especially with other factors like antibiotics, diabetes mellitus, or hormonal changes. Then conditions like HIV, chemotherapy, or certain medications can suppress your immunity, making you more prone to these fungal issues. Hormonal changes that occur during period, ovulation, birth control pills can also cause this vaginal yeast infection. Four is tight and non-breathable underwears. Tight, non-breathable underwears like nylon pants traps heat and moisture, creating a warm, damp environment that encourages the overgrowth of candida fungus, significantly increasing your risk of vaginal yeast infection, especially after sweating. Cotton underwears and loose-fitting clothes are better choices as they allow air circulation, keeping the area dry and helping to prevent infection. Five is use of scented soaps, vaginal washes or douching. Scented soaps, fragranced feminine washes, especially douching, can absolutely cause vaginal yeast by disrupting the vagina's natural protective bacterial balance and pH, allowing yeast to overgrow, leading to irritation, itching, and infection. Health experts recommend only warm water for cleaning the external vulva as the vagina is self-cleaning and fragranced product introduces chemicals that causes harm, not help. 5. Frequent sexual intercourse. Frequent sex can lead to vaginal yeast infections by altering the natural vaginal balance, introducing new bacteria or transferring yeast from a partner to another, especially with multiple partners or oral or anal contact, introducing different bacteria or microbes. Now let's talk about the natural home care tips that are safe and effective for vaginal yeast infection. Keep the vagina dry. Avoid scented soaps down there. Wear cotton underwears. Reduce sugar intake. Air out the vagina. Yes, don't be wearing 3 layers of tight leggings. I don't know why. And please, do not put yogurt inside your vagina. No garlic inside your vagina. No steaming, no herbal mixtures. No toothpaste. No Dettol inside your vagina. No alum, because they all make the infection worse. So how do you prevent this yeast infection? Wash the vulva only with water or mild unscented soap. Avoid douching. Wear loose, breathable underwears. Change out wet clothes quickly. Reduce sugary foods. After antibiotics, watch for symptoms, maintain good vaginal hygiene, and then manage blood sugar if you are diabetic. You need to seek for medical care if symptoms don't improve after 3 days of treatment, if you keep having yeast infections more than 3 or 4 times a year, if you're pregnant, if you're not sure if it is yeast or another infection, and then if you have a pelvic or abdominal pain, which is not normal for yeast infection. Your vagina is not meant to suffer in silence. If you notice itching, unusual discharge, or discomfort, treat it early and treat it right.